Hello, I'm Greg Stock. I'm the CEO of Thibodaux Regional Medical Center. It's a pleasure to introduce Dr. Alan Borne. Dr. Borne is an orthopedic surgeon who specializes in hand surgery, hand care, and we're going to talk today a little bit about what he does and all the great services he brings to the people of this area. As many people know, we've built a wellness center here at Thibodaux Regional. We'll talk about that for just a moment, and then also how Dr. Alan Borne, a great young orthopedic surgeon who specializes in hand surgery, integrates wellness into the care of his patients. On a high level, Thibodaux Regional's Wellness Center has, I think, been a very positive thing for the whole region. The patients we see come from 5 different parishes, and we've seen the participation in the Wellness Center from 17 different zip codes. The Wellness Center, just the fitness center part of it in the first year, saw 350,000 visits and more in the second year. The number of people who are subscribed to our fitness center right now is 5,800 people. And we began with projections of 1,400. Consulting company we had out of Chicago that estimated how far people would drive and what they would pay and all the other demographic attributes of that, and greatly underestimated it. That's good news because it means that people are partaking of the concept of wellness and actually participating in wellness activities. Our purpose is to serve the people that live in this region in the best way we can, in the best possible manner, as well as anybody does it. And that includes wellness now. So we're privileged to have some great physicians that work with us, and Dr. Borne is one of the new guys, very, very well trained, and both in general orthopedic surgery and in hand surgery. And we thought today we'd ask Dr. Borne just to make a few comments about how the Wellness Center helps your patient.
It's certainly a spectacular building, and I utilize its services frequently. But especially having an office in the Wellness Center has really been a huge asset to our practice because we can encourage patients to get more physically active, and really invest their time and their effort into improving their overall health, and it's just right outside of the door. Certainly within the surgical patient, a lot of the outcome is based upon different things: the quality of the surgeon, the quality of the patient's wellness, and how much effort they put into the recovery. And that really ties in the physical, mental, and emotional aspects of wellness. I think there's no doubt that folks who are into their health and into the physical aspect of wellness see benefits in the other aspects of their lives as well. And certainly we see that in recovery from hand surgery or dealing with a chronic painful condition. Oftentimes the patients who are involved with the physical wellness aspect have better outcomes.
And the way I look at it to some degree, so when an acute episode happens, maybe an injured hand or just arthritis that gets intolerable, and you're there to help them. Also is an opportunity to sort of graduate on up to a better lifestyle and improve your life overall and feel better, work better, for retirees to enjoy life, enjoy their families, in a better way, and just a win for everybody.
Absolutely. One of my favorite mentors always told me that you're a doctor before you're an orthopedist, and you're an orthopedist before you're a hand surgeon. So we always remind ourselves to be physicians, and really promoting wellness and that overall well-being and health in general is a big part of what we do.
At Thibodaux Regional, we're an innovator, we believe. We're trying to be a leader in this regard, not just be there, but actually lead. That includes integrating wellness with clinical care. So what Dr. Borne just described, in my opinion, is excellent clinical care. But then when you bring wellness into it and you actually integrate it where it makes sense, wellness doesn't sit over here somewhere and clinical care over there, but they're brought together in such a way that they're very closely coordinated and focused. You really get better outcomes for people, way better. You agree with that?
Absolutely. I think that's the future of medicine, tying in the mental and emotional health with the physical condition, whatever that may be, will give you the best outcome.
Early in the process, but making huge gains and seeing changes in the community and families that are remarkable. Thanks again, Dr. Borne, for coming here today. We appreciate it.
Thank you for having me. My pleasure.